following Burrill Report podcast is made possible through underwriting from Biotech 2009 Life Sciences, Navigating the Sea Change. Burrill & Company's 23rd annual report on the life sciences industry, available now at burrillandco.com. I'm Daniel Levine, and this is the Burrill Report. As the swine flu spreads across more and more countries, the number of people infected with the disease for now remains low. But public health officials are worried that a deadly pandemic may be unfolding before our eyes. The World Health Organization has pushed its influenza pandemic alert to the second highest level and instructed all countries to immediately activate their preparedness plans. Alexandra Stern, Associate Director of the Center for the History of Medicine at the University of Michigan, has conducted extensive research into the response of U.S. cities to the 1918 influenza pandemic. We talked to Stern about the challenges of containing a pandemic in our interconnected world today, about why efforts to limit the effects of the 1918 pandemic failed in some major cities, and what lessons public health officials can learn from the past.
Alex, thanks for joining us today.
Thank you.
The current swine flu outbreak has spread into at least 16 countries, but right now we're not talking about many illnesses or death relative to a pandemic. So could you start by just giving us a historical perspective on the great influenza pandemic of 1918 and why what we're seeing today might cause some anxiety for a medical historian like yourself or public health officials?
Certainly. Well, we know that epidemics like this tend to come in cycles, with every 20 to 40 years, or we've seen them across the 20th century. And they're very hard to predict. So that's what much of the concern is about today. And we know that what we're seeing, the H1N1, is the same type of a virus that we saw in 1918, although it's a different configuration. One of the kind of amazing things about what's going on today, is that we're actually seeing this potential pandemic unfolding in real time. And we're watching cases being reported on a minute-to-minute basis, or even second-by-second basis, and literally seeing the geographic spread on Google Maps and those kinds of technologies. So that's providing a wealth of information that is really helpful to public health officials, epidemiologists, and others. And in a way, as a historian, I'm seeing that as a kind of historical record that we'll draw back on later, and that will be really useful. What our group at the Center for the History of Medicine at the University of Michigan has been doing is really going back and doing a comprehensive and systematic look at what happened in the United States during the 1918-1919 influenza pandemic. And one thing that's important to remember is that pandemic started with a fairly mild spring wave. And that's one of the things that scientists are concerned about with respect to what we're seeing with the swine flu, although it's no longer being called the swine flu, just the type A H1N1 virus we're seeing now, is that this is some kind of a spring wave, and it's unclear what will happen to this virus over the summer, and some are concerned it might have the potential to reemerge in the fall and reach the deadliness in the worst-case scenario of what we saw in 1918. In that case, starting in August and September of 1918, there were some cases in Western Europe and that arrived eventually on U.S. shores around late August, early September, and first hit East Coast cities and then basically traveled westward over the course of the following weeks. So what we've done in our study is we've really done kind of two parts in looking at the U.S. One part, which was published in JAMA, the Journal of the American Medical Association, in 2007, was a study that looked at 43 U.S. cities in the deadliest wave of the 1918 pandemic, so basically from September all the way through the start of the third wave of that pandemic into February. And what we wanted to understand is if you're looking back at a situation where you didn't have antivirals because it wasn't understood that it was a virus, and you didn't have a vaccine, what could be done to contain ideally or at best mitigate the impact of the pandemic? So we measured public health interventions, and these are kind of the traditional public health interventions that a lot of people think of when they think of a decree coming down or what we've been seeing with the closure of schools, and they are school closure, quarantine and isolation, and also public gathering bans. So we looked at those three variables, and what we were able to demonstrate for these 43 cities is that if these public health measures, which are called in the lingo non-pharmaceutical interventions, are implemented in a manner that is early, sustained, and layered, that they cannot contain, but they can mitigate the pandemic, and they can basically do two things that are really important. The first is they can lower the peak mortality curve, so that, if you've seen those spiky curves, for example, for Philadelphia, which is a well-known one for 1918, the idea is that these measures in combination could push that peak down, could lower it, and then it could also shift it temporarily over to the right so that you would buy more time. So you would both lessen the impact on critical hospital infrastructure, and you would have more time to do things like, in our situation today, distribute antivirals and also, if time permitting, prepare a manufacture a vaccine.
You looked at a number of these non-pharmaceutical interventions, ranging from wearing a face mask to washing hands. What, if any of those, proved effective or didn't?
Well, just to clarify, the three that we looked at that we measured statistically in that study were quarantine and isolation, which we took as one NPI, school closure, and then public gathering bans, which is, for example, closure of theaters or, church services and things like that. We didn't include in the statistical calculations either hand washing, because that's just not something that we're able to measure. It's hard enough to measure it today in terms of how many people are doing it. You really need a controlled setting to do that. And then we didn't include face masks either, although we have looked separately at the issue of face masks in the context of 1918, and particularly cities such as San Francisco, which really spearheaded campaigns for face masks and was one of the first cities to implement a mandatory face mask ordinance.
Was there any evidence that was effective?
No, there wasn't. I mean, the verdict on that is really inconclusive at this point. There's several things can be said about face masks. First, there really was, I would say, a well-intentioned effort on behalf of, let's take the case of San Francisco's health commissioner and mayor, to implement the face mask law because they thought it would help control transmission. And the Red Cross worked diligently to distribute masks at kiosks throughout the city, and you have images, you can find them at some of the local archives and on the web now of, San Franciscans in the streets wearing face masks. But I think there are several issues that arise with this. First of all, if going back to 1918, it's not clear that the face masks that were being used could be effective in any case because they were made of gauze, and often very porous gauze that was, maybe 4 layers or 6 layers that was just placed around the mouth. So does that have the capacity to filter out or to filter in or keep out from spreading a microscopic virus? Really the answer is probably not. Another issue with face masks is even if people have the correct equipment, like an N95 mask, are they wearing them correctly? Are they keeping them on at all times, especially when they're out in public? Are they getting too soggy so they're no longer effective? And then finally, 2 other issues. One is that I think one of the dangers with face masks is it can really give people a false sense of security. That, if I just wear this face mask, I can go out comfortably in the streets. I don't really have to be concerned about adhering to the social distancing measures that have been recommended, and so on.